Metronidazole is a medication classified as an antiprotozoal agent. However, due to its action on the anaerobic bacteria, it's also classified as an antibiotic. This medication is available in different dosage forms, such as tablets, capsules, oral solutions, and gel. This medication belongs to the group of nitroimidazoles, and it is bactericidal. That means it kills the bacteria. It is effective against anaerobic bacterial organisms. It is well known under the brand names Flagyl and Metronidazole. This medication is toxic to the bacteria as well as protozoa. Therefore, it has wide clinical uses. However, before using this medication, you should know important things. What is the effect of alcohol while you're taking metronidazole? How can you know this medication affects your liver? How should it be taken with other medications? What is its effect on developing numbness in your hands and feet? All such things are very essential to know. So in this video, we will cover such important facts about metronidazole. Now let us see how this metronidazole works. Metronidazole mainly enters into the anaerobic organisms. One of its main actions is to produce the toxic reactions on the infectious cells. Within the body, metronidazole is generating the free radicals. This can be mediated by interaction with the enzyme called ferredoxin. By this enzyme, metronidazole is going to be reduced, which can release free radicals. These free radicals can interact with the DNA in the bacteria and protozoa. They can produce this DNA strand breakage. This results in the inhibition of nucleic acid synthesis. Without DNA, the bacterial or protozoal cells cannot survive. This may lead to cytal action on these organisms. How to take this medication? Metronidazole is available as an oral tablet and capsule. It is also available as an oral solution and a solution for intravenous injection. As a tablet, it is available in 250 milligrams and 500 milligram strengths. It is also available as an extended-release tablet at a dose of 750 milligrams. These extended-release tablets should not be broken, chewed, or crushed. They are intended for only once daily. It is also available as a gel for intravaginal purposes. The dose of metronidazole depends on the type of infection that is going to be treated. It is one of the medications that can be used for a wide purpose. It can be used to treat amoebiasis, giardiasis, and trichomoniasis. It is also used to treat bacterial vaginosis. Therefore, the dose and the duration of the treatment depend on the type of infection. For example, for treating amoebiasis, the dose may be variable from 250 to 750 milligrams, given 3 times daily for 5 to 10 days. In case of Clostridium infection, it can be given at a dose of 500 milligrams 3 times daily for 10 to 14 days. For treating anaerobic bacterial infections, metronidazole oral solution can be used at a dose of 7.5 milligrams per kilogram every 8 hours. This treatment can be continued for 7 to 10 days. Taking with alcohol. You should avoid taking alcohol while using metronidazole. Metronidazole acts on your brain, and it produces a few of the central side effects like dizziness. Alcohol can also act on your brain, and there is a significant interaction between metronidazole and alcohol. Generally, alcohol is metabolized in your body in a 2-step process. Initially, this alcohol is converted into acetaldehyde. This is a reduction process, and this step is mediated by an enzyme called alcohol dehydrogenase. This acetaldehyde is toxic, and it is going to be converted into a non-toxic component by another enzyme, aldehyde dehydrogenase. However, when you're taking metronidazole along with alcohol, it interferes with this metabolism. It can block the second step where it inhibits aldehyde dehydrogenase activity. This prevents the conversion of acetaldehyde into acetate in your body. Therefore, when you take metronidazole along with alcohol, the metabolism is not complete, and alcohol is mainly converted into acetaldehyde. This results in the accumulation of its levels in your body. Increased levels of acetaldehyde can give you an unpleasant symptoms, and you may feel highly discomfort. You may have a few symptoms like flushing, nausea, vomiting, and headache. These symptoms can be observed with the use of another medication, disulfiram. When it is taken with alcohol, disulfiram produces an aversion towards the alcohol in people with chronic alcoholism. Similar reactions can be observed when you take the metronidazole along with alcohol. Therefore, these reactions are also called disulfiram-like effects. Since these adverse reactions are unpleasant and intolerable, It is recommended that you should not take alcohol while using metronidazole. Even you should not take alcohol after stopping this medication for at least 3 days. Since metronidazole may remain in your body for a few days even after stopping, taking alcohol is not recommended, even after 3 days of stopping metronidazole. Effect on liver. Use of metronidazole for prolonged periods may affect the function of your liver. Therefore, you should take metronidazole carefully if you have any liver disease. In people with liver disease, it can produce acute liver failure or an irreversible hepatotoxicity. Therefore, if you have any liver dysfunction, the dose of metronidazole should be reduced. Notice for the development of symptoms like abdominal pain, nausea, changes in the stool color, and the development of jaundice-like symptoms. They may indicate liver dysfunction. If you observe such symptoms developed after using metronidazole, a liver functionality test should be done. Use in bacterial infections. Metronidazole can be used for treating bacterial infections. Particularly, it can be used for treating anaerobic bacteria. Even though it is not a purely antibacterial agent, it can show some activity on the anaerobic bacteria. It can be used to treat Clostridium infections. However, when you are using this medication for treating bacterial infections, you should complete the course as prescribed. Skipping the doses may increase the development of bacterial resistance. In such conditions, metronidazole tablets may not work properly in the future if you're going to treat such infections. On prolonged use, metronidazole can induce even superinfections. Never use the metronidazole without determining either a bacterial or protozoal infection. Using this medication without proven or strongly suspected infections may result in the development of resistance towards this medication. Therefore, never use without confirmation of such types of infections. Central effects. Never use the metronidazole at higher doses than recommended. Increasing the dose or using this medication for prolonged periods may increase the development of seizures. In people with a history of seizures or any neurological conditions, the use of metronidazole is not recommended. Another important effect of metronidazole is the development of peripheral neuropathy. This may result in the development of numbness and loss of sensation in the arms and legs. It can also produce a few of the central side effects, like loss of balance, dizziness, and confusion. In people with end-stage renal disease, use of metronidazole may result in its accumulation in the body due to improper excretion. In such cases, the dose of metronidazole may be properly adjusted. Leukopenia. If you have any previous history of development of leukopenia or neutropenia, you should use metronidazole carefully. Even though it is not directly producing a lowering of your blood counts, in people with a history of leukopenia or neutropenia, it can increase further risk. Monitor the complete blood count for leukopenia before, during, and even after the prolonged therapy with metronidazole in the presence of risk factors. Even though rare, this medication can produce a few of the hypersensitive reactions that may develop in the skin rashes, blisters, and fever in a few people. Drug interactions. If you are taking warfarin, metronidazole can increase its activity. This increases the risk of bleeding. Therefore, while you're taking metronidazole, the dose of warfarin should be adjusted. Metronidazole can reduce the clearance of 5-fluorouracil from the body. This may result in the accumulation of this medication, leading to its toxicity. Metronidazole can increase the levels of lithium, leading to its toxicity. This may result in increased confusion, dizziness, tremors, and weakness. Therefore, the dose of lithium may be reduced in the presence of metronidazole. Metronidazole can interact with a few other medications that are metabolized by the CYP3A4 enzyme in the liver. Medications like amiodarone, tacrolimus, cyclosporin, and quinidine levels are increased with the use of metronidazole. Metronidazole can increase the QT interval in the ECG. This is due to inhibition of your liver enzymes. When the metronidazole levels are very high in your body, it can produce adverse effects on your heart. It may produce prolongation of the QT interval in the ECG. However, with a normal dose, it may not be observed. When metronidazole is taken with potent CYP3A4 inhibitors, the metabolism of metronidazole may be inhibited. This results in its increased levels in your body. This may increase the risk of QT prolongation. A few other medications can directly produce QT prolongation. Antibiotics like ciprofloxacin, levofloxacin, and azithromycin, when they are taken with metronidazole, can increase the QT interval. Similarly, a few antipsychotics like thioridazine, chlorpromazine, and risperidone can also increase the QT interval when they are taken with metronidazole. Therefore, all such medications should be carefully used while taking metronidazole. These are the important things that you should know about this medication. Share your experience and how it works for you in the comment section below. Thanks for watching this video. Have a great day.